Hi there, I'm Dr. Tausif Umar and I am Clinical Fellow Neonatology at Services Institute of Medical Sciences under supervision of Professor Dr. Taiba Khawarbat. And this video is one of the training videos to guide our new residents and house physicians so that we have better outcomes of our patients. And the objectives of this video would be: we will discuss the prescription writing and the common prescription errors, and understanding the medication errors, and what are the basic components of a discharge slip for indoor patients and the discharge slip for outdoor or ER patients. So here we are going to see in detail the components of the prescription errors and the medication errors, so that this part of our management for any patient is error free, right? So let's begin. The prescription of any patient should include few things such as this. By the way, this treatment ticket has been taken out by a Nini, and we will have a detailed video on our software for prescription writing, discharge slips, and patient record management in another video. So the components of any prescription for an indoor patient, it includes the name of the patient. I have written the test patient, the father name, where the patient is admitted, the date of admission, the time of admission, the weight of this baby, which is 3 kilograms, and it is the height is 50 centimeter. And here you see the baby is just 1 day old, male baby. The hospital number is written here. OFC was taken, it was written here, and the surface area calculated from weight is here. Because few drugs are given according to surface area, let's leave that for a while. The date of birth is 10th August 2019, and this has just been added into the system for the sake of examples. And the diagnosis is early onset sepsis, and the detailed is congenital pneumonia. So the baby is nothing but oral till further orders, and oxygen inhalation via nasal CPAP, follow nasal CPAP monitoring sheet. Okay, that says that there is some other monitoring sheet also. The nursing orders are written here, and the medication orders are here. And finally, you may see that it has been signed. So any prescription which you are going to follow, whether it is computer generated or handwritten, it must have these components as to where the baby is admitted. In pediatric medicine, it is NICU, or in the step-down care unit. What is the weight, patient's name, father name, weight, date of admission, time of admission, date of birth, time of birth, and other parameters regarding biodata. Or early onset sepsis is the diagnosis here, what are the nursing orders, what are the medication orders, and finally you have to sign. See here in detail that beside these orders, date has been written. Okay, here date has also been written, and here is the time when printout was taken. So all medications, when those medications were started, the date and time should be mentioned, so that we are able to see who is starting the medication and at what time and what day. So in the sequence here, since it is the first day, we have given here 10% dextrose water, 60 ml 8 hourly, because the weight is 3 kilograms. According to the weight of the baby or the status such as prematurity, or if the baby is full term, there is differentiation in the volumes of fluid given. Okay, so the volume of fluid is basically dependent on prematurity, or if the baby is full term, and also on weight. Okay, and the third thing, it is day of life. The volume is calculated here based on weight of 3 kilograms. And the type of fluid here is 10% dextrose water, which depends on the day of life. So on the first day of life, we have 10% dextrose of water. On second day of life, we add N by 5 sodium, and we also add potassium, but this practice varies from setup to setup. In some setups, in neonatal fluids, sodium and potassium are added on third day of life, right? So please check the description of this video for a link to a PDF file that contains information on this thing, okay? Or if you are on network, then there will be a folder named as adjuncts. In that you will see the documents and the necessary PDFs which we have created to facilitate you. So see here that 10% dextrose water 60 ml is given via microburette 8 hourly at 60 ml per kg per day at 7.5 microdrops per minute. Just for the time being, forget that injection dopamine or dobutamine is written here. This much fluid order says that 10% dextrose water 60 ml has to be given intravenously via microburette at 8 hourly. When we are writing manual orders, this is computer generated. When you are writing by pen, you must write how much fluid is being given and at how much drops per minute. The easiest way to calculate the drops per minute while for a microburette, it is that you have micro drops per minute is equal to fluid in mLs over hours. Let's say that you have to give fluid of 100 mLs over 8 hours, right? So the answer, I'm very poor at maths, you know. So the answer here is 12.5 microdrops per minute. Right? In the manual that it is there in the description of this video, there is a formula to calculate the fluid rate via drip set also. So this is the fluid rate that is via microburette. It is the beauty of this our prescription system, which is NINI, that it calculates by itself the microdrops per minute, so that the staff nurses know that at what rate the fluid has to run, because you know we are in one resource limited setup where we sometimes get droplet regulators made of plastic, or we have just few infusion pumps. So we must know how to slowly give fluid, otherwise this fluid will be given abruptly. Like if this 60 ml goes in 3 hours, it would be devastating for the baby. For the next 5 hours, what would baby do? So ideally, this should be an hourly fluid, right? It should go via infusion pump. But provided that we have so much load in our setups, and that the nursing to the staff nurses to the baby ratio is very, very low. So we have too many patients, and we have to cater ourselves, change ourselves in a way that we do not do mistakes, and we have to be smart in these things. Okay, so this is how you give fluids. And see here that injection dopamine, how much mLs and how many milligrams have to be given. So it is being given at 10 microgram per kg per minute. Dopamine and dobutamine is given at 10 microgram per kg per minute, and the mLs for both are written here, right? So when you how do you calculate this in mLs straight away? Well, the formula that I remember, it is that for calculating the dose of dopamine, it is 0.012 into weight into dosage, and the dosage could be 5, 10 or 15 or 20 microgram per kg per minute, and the answer will come out in mLs, right? So if you have, let's say that the weight of the baby is 0.0123 kilograms, and the dosage that we are giving is 10 microgram per kg per minute, the answer should come out to be, let me calculate, the answer comes out to be 0.36 mLs, right? 0.36 mLs. And see, the computer calculated for us by its own here. You can see here that this is 0.36 ml if we are giving it 10 microgram per kg per minute, right? We can do this manually also. Okay, but the point here is that the proper orders to add inotropes into maintenance fluids, these are this. You have to write them along with the maintenance fluids so that these calculations are for 8 hourly fluids. If you are writing them separately, you are doing it wrong. Whether you give the fluid via syringe pump, via fluid electric infusion pump, whether it is being regulated at this much drops via droplet regulator, which is made of plastic. Let me show you the droplet regulator. This here is the droplet regulator. You see, it has a small dial, and this dial can be rotated. It comes in two forms. One has a dial for mLs in 8 hours, and the other has a dial for setting the drop rate as here we want. So this is a plastic thing. One thing attaches to the patient and the others to the fluid source, right? And let me also show you the infusion pumps. These droplet regulators are available in Pakistan, okay, and available in Lahore very easily for around 200 rupees. And this here is the syringe pump. We have this version of brown available with us. Very good pumps these are. And the other thing that I was talking about, those were infusion pumps, right? Let me show you that infusion pump. This is the infusion pump, and these are also available with us. However, we have few of these, right? In this type, the tubing passes from above to below, right? The tubing of the drip set, and you simply type on here that how much fluid over how many hours has to go, and it has active mechanism of milking the tubing of the drip set. It milks fluid through the tubing to the patient, right? Let me show you this thing in usage. So here you may see that a tubing has passed through that infusion pump. Let me focus here. Right, so please check our own infusion pump and you will see how it works. Next, we were saying that dopamine and dobutamine must be written with the maintenance fluids, or if you are separating the fluid volume of maintenance from dash of inodrop, write the order separately. Let's suppose that you say that I wish to give infusion 10% dextrose water 40 ml. I will cut the orders down and I will cross like this, changing fluid volumes. The time at this moment is 8:44 p.m. 11/8/19, and I am safe. So I would write that infusion 10% dextrose water into 40 ml IV 8 hourly via microburette at how much drops? Well, 40 divided by 8. Let me calculate. At 5 micro drop per minute. Now this is the maintenance, and infusion 10% dextrose water into 20 ml into IV 8 hourly via microburette 8 how many drops? ml over hours, 20 ml over 8 hours. It turns out to be 2.5 microdrop per minute. Here I am adding plus injection dopamine 0.36 ml, which is 14.4 milligram, which is at rate of 10 microgram per kg per minute, right? So I would write the time here. It is 8:46 p.m. 11/8/2019, and I am Tosif, right? So these are the proper medication, proper drug orders, fluid orders, that is 10% dextrose water. Here the maintenance has been separated from this, right? I hope you get the idea now. Here I wish to convey you a message, like let's say that someone says that your consultant orders that increase the maintenance fluids to 60 ml. What the normal practice is that you just cut it here and write 60 ml. This is utterly wrong. You never cut the or overwrite any of the order. If you have written it wrong, you have to cut the whole orders. Comment why have you cut it. Are you holding it? Are you changing the fluid volume? Are you changing the fluid type? I am changing the fluid volume. Changing fluid volume. The time being 8:47 p.m. and today is 11/2019, and I am Tosif. You must sign it. And now what I am changing to, let's say infusion 10% dextrose water into 60 ml IV 8 hourly via microburette. You can always take these printouts from our Nini software, and I encourage that you use the Nini software for this thing, because in Nini it would take you just 10 seconds to change the fluid volume. We will have a separate video on how to use Nini. For the time being, I wish that you minimize your medication errors. So your orders should be crisp. Here at how much drop? 60 ml. It would be around 8 hourly, so it would be the same 7.5 microdrops per minute, right? So, and I will write here again the time, the date today, and I'm Tosif. Alright, I hope you have the idea that every drug order must have a time, a date, and the signatures of the one who is starting. And yes, the accompanying notes in your short notes as to why have you taken these orders or on whose commands and what was the rationale behind this thing. I hope you have the idea. Moving forward, let's say that this baby is now second day of life, or this baby is at third day of life, let's say, and you have planned to change the fluid type. What the normal routine that residents are doing, they just cut it and they write N/5 with 10% dextrose water, and they change the fluid type into let's say 80 ml. No, this is utterly wrong. What you have to do is you have to cut it. You have to comment that I am changing fluid type and volume. The time today is 11/8/19, and the time is 8:50 p.m. and I am Tosif. And where are the new orders? Here they are. Infusion N/5 with 10 with 10. Now here is a mistake. I have made a mistake. What should I do? Should I overwrite? No, never overwrite. Cut it, write the newer orders. Infusion N/5 with 10% dextrose water into, let's suppose, 80 ml IV 8 hourly via microburette. at, let me calculate ml over hours. 80 ml divided by 8 hours, it comes out to be 8 microdrop per minute. I hope you have the idea. You may also comment using Droplet Regulator. The orders are yet not complete. I must write here the time, the date, and I am Tausif. And in my notes, I must mention that since it is the second day of life, I am adding this thing, changing the fluid type. Or if I wish to add to it potassium, I must write with injection KCl 2 cc per 100 ml, which is how much? 2 cc per 100 ml. You must calculate and write here. So I have used my calculator, and 2 cc per 100 ml for this much fluid, it comes out to be 1.6 ml of KCl. I hope you have the idea. Never overwrite. Never overwrite. If you have written in wrong, if you are changing the drug dosage, you must cut the whole orders and write the newer orders, right? Let's suppose that your consultant says that this patient is now a suspected case of meningitis. So you must add to here treatment ticket that there is high suspicion of meningitis. You must write that in notes also, that we will discuss in another video. And he says that change cefotaxime dosage to, let's say, 250 milligram per kg per day divided 6 hourly. He says that start cefotaxime in meningitic doses, which is, let's say, 250 milligram per kg per day divided 6 hourly. And I wish to convey to you that we will have another video about what are the best sources to check for drug doses in both pediatric and adult age groups, and we will have in that video discuss what are the best softwares which are available for free and the best websites or the online resources which can help us groom our knowledge and hence better patient outcomes. So the consultant says that start cefotaxime at 250 milligram per kg per day divided 6 hourly. What should we do? Should I use a calculator and write the newer dose here, which is 3 kg baby, and change it to 6 hourly? Should I do this? That if a baby is to be given 250 milligram, let me calculate, I'm very poor at maths, 250 milligram per kg per day, okay, divided 6 hourly, divided 6 hourly means divide by 4. Okay, it comes out to be 187 milligram. Let me make it 185 mgs. Should I write it like this? No, this is one wrong practice. You must not do this overwriting. You should have, what should have been done is that you should have written here changing drug dosage and frequency, and the time being 8:55 p.m. and the date is 11/8/19, and the newer drug orders must be written here, or better take a printout from the computer. We have to develop this habit where things are written neat, clear, and error-free. No overwritings, no cuttings. Better you take the printout. Or if there is some problem with the networking with the printers, please groom yourself, mend your ways. So here it is, injection cefotaxime 185 milligram IV 6 hourly, and date is 11/8/19, time is 8:56 p.m. and I am safe, right? And why it is being done? You should mention it, then the patient notes. So this is the way. So this is how we should have our medication orders, drug orders here. Now, the second thing you have to look for is the medication chart of staff nurses. If you have written 25 milligram IV 12 hourly here, which is 16.7 milligram per kg per day, is the staff nurse following the same orders, or is she giving something else? Have a look at the end of the chart where you will find the medication chart of the staff nurse, where she mentions that I have administered 25 milligram at 6 p.m. The next dose I have administered at 6 a.m. and she signs it. You must see that is it 25 milligram, or in its case, as this Kifotaxime has been changed from 150 milligram IV 12 hourly to 185 milligram IV 6 hourly, please convey this to staff nurse, or better, go turn over to her medication sheet, cut the previous dose and comment there, doses has been changed, please have a check, right? Because in our setup, staff nurses write the drug's name, dose and route on their medication chart, so better let them do their job. Just comment there and convey to them that the dose of Kifotaxime has been changed. And but do have a look at them. Also, from time to time, have discussion with staff nurses as to if these availability of the drugs, if the drugs are available or not, because it could happen that you are writing the drug here but the hospital is not providing it. See, we are in one resource limited setup. So what is the source of this drug? Is the family able to buy these drugs, right? You should have a check on this. And poverty is not a reason that any patient doesn't get good treatment or is deprived of some treatment, of best management, right? So it is your or it is my responsibility that we provide that patient with this drug if the hospital is not providing and the patient does not have money for it. I hope you have the idea. Second thing that comes to my mind here is that Kifotaxime, or let's say Augmentin or Amikacin, mostly these drugs once prepared, right, these come in powder form, and once prepared using distilled water must be used within 24 hours, and these must be kept in refrigerators. For some drugs, like for some manufacturers of co-amoxiclave, which comes with the brand name of Augmentin, it is mentioned that use within 6 hours of preparation. Like Calamox, for meropenem, I once read on a leaflet that use within 24 hours, and the other brand name, it said that use within 18 hours of preparation. So the drug which comes in powder form is prepared using distilled water, must be used ideally according to the manufacturer's specifications that they give, that use in this much manufacturer's instructions, that in use in this much period of time after constitution, you must not exceed that time. You must have conversation with staff nurse that if she is using the drug in that specific time and discarding the rest of the drug. For example, many drugs like meropenem, if it comes in 500 gram vial and only 100 is being given to your premature baby, let's say, what happens to the rest of the 400 milligram? She must waste that after 24 hours, and in that 24 hour the drug must be kept in the fridge, right? Now let's move forward to the drugs which are given in infusion form. Let's say that the baby has seizures and you gave SOS diazepam and now you are starting with phenytoin. You would say that load with injection phenytoin, which is the loading dose is 20 milligram per kg into 60 milligram IV. Would you write stat? You guys are writing it as stat. This is wrong. The orders that you guys are writing, I will correct them in a while. You guys are writing as load with injection phenytoin 60 milligram IV stat, then injection phenytoin 3 kilograms weight, the dose is 5 to 8 milligram per kg per day divided BD. Injection phenytoin 7.5 milligram IV 12 hourly, and you do not sign it or write the time. These are the orders that are being written by registrars here. So it is wrong. It is not stat. You must write here. Since these are the wrong orders, we will correct them as bolus in 20 cc normal saline over 30 minutes at how much? 20 ml over 30 minutes, which is 0.5 hours. Let me calculate. Ml over hours at 40 microdrop per minute via burette, right? These are the orders to give this loading dose of phenytoin. You must mention here that it is in bolus of 20 saline over 30 minutes or over 20 minutes. You may give over 20 minutes also. And then injection phenytoin at least 20 minutes. Injection phenytoin 7.5 milligram IV 12 hourly. The comments here should be the same ones. After 12 hours of loading dose, in 20 cc saline over 20 minutes, right? And 20 minutes, let us calculate ml over hours. Twenty minutes is 0.33 hours, and 20 cc ml divided by 0.33. So at 60 microdrop per minute via burette, right? I hope you have an idea. And now I will sign it here. 9:04 p.m. 11/8/19, and I'm Tausif. These are the orders for loading phenytoin and for maintaining it. So you will write that load with injection phenytoin 60 milligram IV stat as bolus in 20 cc normal saline over 30 minutes, minimum 20 minutes at this much drops per minute, and injection phenytoin after 12 hours of the loading dose. You will maintain it. Sign and date and time. I hope you have an idea. The drugs such as aminophylline or mannitol, these are given over longer periods. So you must write here what is the duration in which you wish to give it. Okay, you just don't write that aminophylline 20 milligram is to be given 8 hourly. No, very wrong. You must tell staff nurse that how much dosage over how much time has to be given. So let me show you here what are the 6 rights of the patient regarding drug dosages. So it is the right of every patient who is admitted with you that he gets that while administering the drug, you see that it is the right patient, right drug, right dose, right route, right time, and the right documentation. These are the 6 rights. And you must fulfill all these rights of the patient in your treatment ticket, such that is it the right patient, test patient, is it the right drug, is it the right dose, is it the right route, is it the right time, and I have done the right documentation for it. That is how it is. Moving forward, We have yet discussed only the fluids, fluid type, fluid volume. It is out, the broad discussion is out of scope of this video, and the necessary information is in the accompanying manual, which is in the description of this video if you are seeing it online, or in the adjunct or the accompanying folder if you are on network. And we have also discussed that how do we administer the stat drugs, how we administer drugs in bolus. We must sign the treatment ticket, sign date, time, and stamp the treatment ticket if you are in setup which have SOPs including the stamping. Moving forward, we will include now tablets and the syrups. So we will now discuss how do we calculate dosage in mLs from syrups, and how do we administer drugs in tablet forms to kids, right? And proceeding to that, I would like to discuss is with relation to discharge slip in the emergency department, right? Okay, so this is one patient whose name is ABC, aged 4 years, and his weight is 24 kilograms, let's say, and this kid had presented to you with a complaint of fever from past 2 days with flu-like symptoms, and you have taken other detailed history, done the complete examination, and the final assessment was that this is perhaps a viral upper RTI. So you write here the diagnosis of upper respiratory tract infection, right? And we are discussing the discharge slip of the patient who has to be discharged from emergency or outdoor department. And you would mention here a little detail that complaint of fever from 2 days and flu-like symptoms, and you should mention here a little examination findings that throat is congested, posterior pharyngeal wall congestion, clear flu, and just the salient points of all your detailed history and examination, and that the respiratory rate came out to be 24 per minute, and chest has bilaterally normal vesicular breathing pattern, no added sounds. So you would also write here that active, alert, cooperative, or irritable, you may say, and you should write here the what danger signs that you have like danger signs explained to mother, right? And so the practice that you guys are doing, you write here that बच्चे को ज़्यादा पानी पिलाएं, ठीक है? You are encouraging fluid intake. Then you give them paracetamol syrup 24 kilograms. You write here, let's suppose syrup Panadol, and you simply write here 1.5 चम्मच सुबह दोपहर sham. This is wrong practice, and you guys are doing it. How do we correct it and why it is wrong? ये कौन से वाला चम्मच है? What size this spoon is? You should write this in mLs. First of all, you should have written the orders here as, let's say, if I have to show you a syrup, I have here with me syrup Calpol, and it writes as it is 6+. Syrup Calpol has paracetamol. Oh, it has paracetamol, and see here that it is 250, each 5 ml contains paracetamol 250 milligrams. Shake well before use, store below 25 degrees Celsius. You have to tell this to mother. You must read and know it yourself. So if I were to write syrup Calpol, I would write the orders as syrup Calpol. The strength is 250 milligrams per 5 ml. And now I know that the dose, it contains paracetamol, and the dose of paracetamol is 10 milligram per kg per dose, right? I will do my own calculations here for your sake, so that those who are learners must learn that they can do calculations on discharge slip, so that there are little minimum errors, okay? So 10 milligram per kg per dose, it is the dosage for paracetamol. The weight here is, let's say, 24 kilograms. So 10 into 24 comes out to be 240, and it is 250 milligram, nearly the same dosage. So what I would do is, I would say शीशी हिलाकर 5 सीसी सुबह, 5 सीसी दोपहर, 5 सीसी रात को पिलाएं. Right? I would give it continuously for 2 days, and later on, so I write here that give it for 2 days, 2 दिन, इसके बाद जब बुखार हो तब पिलाएं. बच्चे को ज़्यादा पानी पिलाएं और नज़र रखें कि निढाल ना हो. उल्टियाँ ना आए, झटके ना लगें. अगर बच्चा खाना पीना छोड़ दे. I'm giving you an idea that discharge slips components are biodata, diagnosis, weight, a little component of history examinations, such that the examination tells that in your examination SOMI are negative and GCS is 15/15 and there is no respiratory distress with clear chest, so that it is only upper RTI, not LRTI. This can be minimal few sentences or few words, and then you document here that danger signs are explained, or else if you have time enough you write in Urdu the danger signs, right? And the further plan, right? 2 days, 2 दिन के बाद दोबारा check कराएं, and you then have your signatures, your name, and the date and time. This is what I wish to say, that we must write strengths of syrups and then in mLs how much we wish to give. This is one example of Calpol. Another example is, let's say that there is an indication to give cefixime, or let's say there is an indication to give co-amoxiclave. Co-amoxiclave comes out to the name of augmentin, and let's say that if I am giving augmentin, I would write the orders as syrup augmentin, whether it is 156 milligram per 5 ml or it is syrup augmentin which is 312 milligrams per 5 ml, right? You have the idea. This is augmentin DS. Our further strengths are also available, drops are also available. Let's be simple, that if the child's weight is let's say 10 kg, and you are giving augmentin by 40 milligram per kg per day, I would do calculations when I was junior. 40 milligram per kg per day divided, let's say I would give divided 8 hourly. You can also divide into 12 hourly. So weight is 10 kg. The total dose is 400 milligram per day. And divided 8 hourly. Let me switch back to my calculator, which says that 400 divided by 3 comes out to be 133 milligrams. So see, if I'm using this one 156 milligram per 5 ml, but I have to give 133 milligrams, so 156 milligram is in 5 mls. 1 milligram is in 5 ml divided by 156, and 133 milligram will be 5 over 156 into 133, which is 5 divided by 156, 4.2 ml. So I will just round it off to 4 ml, and the orders will be शीशी हिलाकर 4 सीसी सुबह, 4 सीसी दोपहर, 4 सीसी शाम को पिलाएं. How many days? 7 days, right? This gives us a good idea. Let's say that we are advising, what else we are advising? Let's say I'm giving antihistamine, and the age of the child is 2 years, and I am giving cetirizine. Okay, it comes with the brand names of syrup Zyrtec. I should write here that syrup Zyrtec, which has cetirizine. I must write what is it, which is 5 milligram per 5 ml. So I would advise it here that 2.5 cc रोजाना शाम को एक बार पिलाएं for only, let's say, 3 days. Right? I hope you have the idea. Now let me show you the syringe. You are well aware of the syringes, but how to give, you have to demonstrate this to the mother. Let me show you. The instructions that you would give to the mother, you would demonstrate to her that discard the syringe of the needle in pharmacy so that at home no one is hurt, right? Better give it at pharmacy and show her that this is 1 ml, 1 cc, this is 2, 3, 4, 5. I am telling you to give 2.5, midway between 2 and 3, this much of the syrup once daily, right? Or in case of augmentin, I am advising you to fill up the syringe till 4 mark and give it thrice daily. I hope you have the idea. Or in case of Calpol that we've discussed, I am advising you to give 5 cc. See, never tell her, never advise her to give 1 चम्मच सुबह दोपहर शाम. Which spoon? Yes, she can do it, that she measures her spoon, standardizes her spoon according to this syringe. If she has spoon, you can tell her, this is done in case of the medications which are given chronically. Let's say in chronic cases, like let me find my needle, and here, like in case of sodium valproate. Here is a case of seizure disorder, and with developmental delay. The cause is post meningitic sequelae, right? Let's say, and you have maintained the patient fits free on sodium valproate, and it valproic acid syrup. The weight is, let's say the weight is 10 kilograms, okay? 10 kilograms. And syrup Apivol, which contains valproic acid in the strength of 250 milligrams per 5 mils, and say you are giving it, I would do the rough work, I am giving it 30 milligram per kg per day. The weight is 10 kg, so 30 into 10 per day, it comes out to be 300 milligrams. I would divide it in 2 doses, so it will be 150 milligram into 2 BD, okay, bice daily. Let me reevaluate. I'm giving in the dose of 30 milligram per kg. 30 milligram per kg per day. Weight is 10, 300 milligram divided 12 hourly I wish to give it, so 150 milligram BD. The dose strength is 250 milligram, so 250 milligram is in 5 mls. 1 milligram is in 5 over 250, and 150 milligram will be in 5 over 250 into 150. Let me use the calculator. It is 3 mls. So I will write here 3 ml सुबह पिलाएं, 3 ml शाम को पिलाएं, जारी रखें. I will advise along with it tablet folic acid. Let's say I would say आधी गोली रोजाना दूध में मिलाकर पिलाएं. Write signs and steps or date and time. Here I will say to mother that standardize your small spoon at home. That if it is 3 ml, better give it with a syringe, okay? That 3 ml in the morning, 3 ml in the evening, or if she wishes to standardize her syringe, that the spoon levels, if there are various volumes, various sizes of spoons which she can standardize, mother can standardize at home for 3 mls. I hope you get the idea. So she would administer with the spoon this much doses of valproic acid. I hope it gives you an idea. Now coming up onto the full drugs. Many tablets like as phenobarbital, anti-epileptic drug, barbiturate, folic acid, or even furosemide, Lasix, along with spironolactone, comes with the name of spiromide. We give it frequently to congenital heart disease patients like VST. So I have this folic acid with me, and it says that tablet, British pharmaceutical, 5 milligram. Okay, so one tablet will have 5 milligrams. Right, I am taking one tablet out of here. So this tablet is 5 mg. Let's suppose that this is a tablet of let's continue on this tablet. It is 5 milligrams. There is a line on it so that it can be halved, divided by 2 to 2.5 milligrams, right? Another way to do is take it in the clean paper, strike it with something hard, powder will be there, open up the syringe. Now drop all that powder into the syringe and fill it up to 5 cc mark with water, close the syringe, shake it, and it will form a suspension such that the drug will be 5 milligram per 5 ml. This will be the strength that you have made from this tablet, right? So you can either half the tablet and give it, or you can give 2.5 cc per day and keep the other 2.5 cc in the fridge. Why I wanted you to learn this method by giving the syringe? Let's say that we are giving tablet furosemide, tablet Lasix, which is 20 milligrams, okay? and I am giving it to my 3 kg old neonate who is being discharged home. He's a case of ventricular septal defect who had pneumonia and which is now resolved. Alright, so this was the case of VSD. Let me focus it. So this was my child, neonate, VSD, having pneumonia, which is resolved, and weight was 3 kg. The name is ABC, and aged 15 days only. Date of admission, time of admission. We are not going into the component of discharge slip right now. So here we see that VSD with pneumonia, which has resolved, 3 kg weight. I have checked my resources, which say that I have to give 2 milligram per kg per day of furosemide divided 12 hourly as a preload reducing agent, Lasix, right? So the tablet furosemide comes in 20 milligram, but the weight is 3 kg. The dose that I have to give per day is 3 into 2, 6 milligram per day divided 12 hourly, or I have to, this is my rough work, okay, or I have to give 3 milligram per dose, right? I hope you get the idea. The tablet that comes, it is too much. It comes in tablet Lasix. I cannot administer injectables at home. The baby is going home. So a tablet Lasix is 20 mg. It is also available in 40 mg. So how would I tell mother that administer 3 milligram? Let's use a calculator to see how much part of the tablet has to be given, okay? If 20 mg is in 1 tab and 1 mg is in 1 divided by 20 and 3 mg is in 1 divided by 20 into 3, calculator, 1 divided by 20 into 3, it is only 0.15 tablet. How would you tell the mother to give 0.15 tablet in the morning or in the evening? The easiest way to do that is let me get paper. The easiest thing to do that would be to first make powder of that tablet, pour that powder into a syringe. Let's say if I pour that powder into this 5 ml syringe and fill that powder fill it with water up to 5 ml and shake it, it would turn out to be 20 mgs per 5 ml, right? So 20 mg per 5 ml. What if I have a 10 cc syringe and I pour that powder into 10 cc syringe, right? What would that be? And fill it up with water such that it is up to 10 cc. The strength of that suspension would be 20 milligram per 10 ml, right? So I would not use 5 cc but this range of 20 milligram. That would make me, every 1 ml contains 2 milligrams, right? Either 20 milligram has 10 ml. In 10 ml, 1 milligram in 10 divided by 20, which is 0.5 ml. Oh, I'm so poor at maths. 0.5 ml. So one milligram in 0.5 ml. If this tablet of Lasix, which is 20 milligrams, powder is made out of it, right? And it is poured into a 10 ml syringe. up to 10 ml fluid or saline or water has been filled and it is shaken, then every then the 1 ml contains then the 0.5 ml is equal to 1 milligram. Let me do it otherwise. That is, in 10 ml there is 20 mg. In 1 ml there is 20 divided by 10. It is 2 mgs. So every 1 ml contains 2 milligram, or otherwise every 0.5 ml contains 1 milligram. So this patient, where I calculated that I have to give 3 milligram per dose 12 hourly, I would simply tell the mother to give how much? Here that we calculated the dose of 3 milligram per dose to be given 12 hourly, and our strength is now that 1 milligram is 0.5 ml. I would say 1.5 ml सुबह, 1.5 ml शाम को पिलाएं. जैसे सिरिंज में महलूल बनाने का तरीका बताया उसमें से. And for demonstration I would write in Urdu here, 10 cc की सिरिंज में गोली पीस कर डालें और 10 के निशान तक पानी भर दें. पिलाने से पहले सिरिंज अच्छी तरह हिलाएं. बाद में सिरिंज को फ्रिज में रख दें. Right? Then what I would do, I would ask her to make it in front of me. I would ask the husband of this woman, the father of this child, to come and make himself this suspension. I would see if there are any errors. Then I would supervise the first dose in front of myself so that there are no hazards at home, right? And then I would document here on chart that demonstration given, father and mother both are able to administer this drug. They are capable enough to make this suspension. The other thing which is expensive, you could ask pharmacy, Fazaldin's Pharmaceuticals, to make this much syrup for you or this much parts of the dosage tablet for you. Well, I would say don't go for that. Make it yourself. This is very easy way. So we are so far done. We are now done with syrup strengths and the tablets. Okay, let me introduce you to this manual I was saying. So this is the Mayo Pediatrician's manual, and here in this manual I am showing you only the part which is related to drug dosages, tablets and the syrup strengths. Okay, let me show you. Okay, so here are the drug doses in this manual on page 21. The PDF is available in the link on description, and if you are a network, in the accompanying folder. And the common pediatric drug doses. See, acetaminophen, it comes with the name of paracetamol, Calpol, Panadol, 10 mg per kg per dose every 6 hourly, syrup 1 or 8 hourly, or as needed SOS. Syrup comes in 120 mg or 160 milligram per 5 ml. The Panadol is 160 milligram per 5 ml. The syrup Calpol is 120 milligram. The syrup Calpol 6 plus is 250 milligram per 5 ml. Okay, and the drops 80 milligram per ml. Your resident will supervise you, or the senior in charge, dear house physicians, that what are the strengths available. This is just an idea. Syrup Brufen 10 milligram per kg per dose given 6 hourly or as needed, not necessarily 6 hourly. The strength is 100 milligram per 5 ml. Syrup Brufen DS is 200 milligram per 5 ml. Okay, you may browse through other drugs which are written here and the necessary indications or whatever you are looking for, their brand names, etc. So this is just the beginning of these drugs and the inotropic agents that we discussed here. I have written in detail here the formulae for how to calculate them. The detailed discussion that goes beyond the scope of this video, which includes working with resources for these dosages, that is in another video. Now moving forward, there are a few minor other mistakes which are very hazardous and I wish to discuss this here. You see the inotropes that are dopamine HCl, dobutamine HCl or adrenaline infusions, these are acidic forms. Whenever we advise sodium bicarbonate, please make sure that staff nurses do not give sodium bicarbonate by giving them in fluids same as inotropes, because this will react and this will balance or make salt with it. So sodium bicarbonate must be given by a separate IV line, and dopamine or or while holding dopamine adrenaline for a little while if you can, if the patient's clinical status warrants. Otherwise these have to be given all the time if these are ongoing, because these are inotropic sports. So better give sodium bicarbonate via another IV line if you have to give for any indication. Likewise for calcium gluconate, if you are giving ceftriaxone or any other drugs which are not compatible with gluconate, calcium gluconate, you must give it from a separate IV line, or there will be salt formation or precipitation of calcium in that IV line, right? So we have just discussed the discharge slip of our emergency patients, that the discharge slip of an patient from an OPD or ER, it must include in short the history, examination points, the important negatives which are not here in the patient, and apart from biodata, the date of discharge, time of discharge, the diagnosis, the instructions must be clear regarding management of fever, feeding, more fluids, whatever you are giving like ORS, and then the drugs with a proper formulation, what it contains as an active principle and what is the strength. Let's say 5 milligram per 5 ml. Let's say it contains cetirizine, right? Or how many cc to be given, how many frequently, and that what danger signs should mother look for, ke khatre ki alamat ye hain, and the signs and ye, right? These are the components of discharge slip from emergency. For the discharge slip in the indoor patient, you must mention for indoor patients that what is the biodata. Better take it from Nini. The discharge slips from Nini are very cute. These include biodata. I will show you those discharge slips soon in another video. Biodata, the weight, date of admission, time of admission, mode of admission, the presenting complaints, the detailed history, the examination findings, then right here the detailed diagnosis including all the issues that have been there, like it was pneumonia with congenital heart disease, which was VSD, and congenital heart disease, heart failure, bracket, in the bracket you may write resolved, right? And then progress involved, the condition at discharge. These are written in Nini. These all headings are there. Please follow Nini. Or if you are writing with hand, none of the steps should be missed. Condition and the medications at home. The medications for discharge. Follow the same things as I told you for discharge slip, and the danger signs that the mother should be aware of or the caretaker should be aware of at home. Khatre ki alamat, right? And so this somehow sums up all the things. And how would you follow the follow-up? कितने दिनों के बाद दोबारा चेक करवाने आना है, कौन सा टेस्ट की रिपोर्ट लेकर आनी है, and this is the basic thing that we wish to discuss today. In the next videos, we will cover up many other things. And right now, if you have any query, you can communicate with your residents or with me. Thank you very much.